Hi, Mark. My name is Lisa, and I'll be your nurse today. I'm pleased to meet you. Because we're just getting to know each other, I'm just going to ask you a few questions. Is that okay?
Sure. Yeah, no problem.
So, originally, what brought you to the hospital?
I'd had some previous health issues. 15 years ago, I'd had heart attack, and I'd ended up in the hospital. But I've done pretty well since. Recently, I noticed that my legs were getting quite swollen, and that I had gone and weighed myself, and I was probably like 15 pounds more than normal, and it seemed like that weight came out of nowhere. So I thought that was kind of weird, and then I was having shortness of breath, which was new for me. So I came into the hospital.
Well, thanks for coming in. Have you noticed any recent changes in behavior with your oral intake at home?
Well, I've been scared to go to the grocery store lately, and usually eat a lower sodium diet, but I've been eating a lot of saltier takeout food, and I know that those are the types of food that I should avoid.
Well, thank you for coming in when you felt that you needed it. I know it was probably a really difficult decision during this uncertain time, but you made the right choice. So, the doctor has been in to see you and assess you this morning, and she has decided that you will be discharged. She feels safe to discharge you today. How do you feel about that?
I feel good. I feel like I'm doing much better than I was, and I think I'm ready to go home.
Good. So, before you leave, our policy is that we do a full head to toe assessment, if that's okay. Now, previous to this, I did take a set of vitals from you this morning. Your temperature was 36.6, and that means that you were afebrile. Your heart rate was 76, and what we're looking for is between 60 and 100 for your age. Your respiratory rate was 16. We're looking between 12 and 20. Your blood pressure was 126 over 76, so I'm looking for something above 90 over 50 and below 140 over 90. And your oxygen sat was 98% on room air, and I'm looking for anything over 95% on room air, and your 98% is significantly higher than when you came in, so that's excellent. So that looks good. And I'm going to start the assessment now, if that's okay.
Yeah, that's fine.
Okay. So let me just close the curtain, Mark, okay, to give you some privacy. Are you warm enough?
Yeah, no, it's quite nice in here.
Okay, great, because we do have some complaints about the temperature in the hospital.
Yeah.
So right now I can see that you're sitting up. You have no additional effort with that. You're not unusually pale. You're not cyanotic. What I'd be looking for is some bluishness in your lips and around your mouth. You are alert and oriented. You're answering appropriately. You don't appear to be in any distress. And I'm not seeing any visible increased work of breathing. You're answering in full sentences without any issues, and I just want to confirm. Are you experiencing any shortness of breath at this time?
No, I feel good.
Okay. Any chest pain, Mark?
No, nothing.
Good. Any pain anywhere that I should be aware of?
No, nothing.
And how is your intake at this time?
Well, I've been happy with the food that I've been having. It seems more like the food that I was used to having before the hospital. I noticed that it's lower in salt, and it definitely seems well balanced.
Great. So I did note in your history that you do have a history of migraines, and that at home you take medications for this. The nursing report gave me information that you had a migraine 2 nights ago, and I was wondering if you could ask you a few questions about that.
Yeah.
Okay. So when you had this migraine, can you tell me anything that was making it worse or better?
Well, I can tell you it was very noisy in my room that night. My roommate was yelling out. I think he was confused, so that didn't help. Also, he had all the lights on. The bed alarms kept going off, and it was unsafe for him to walk to the washroom unaided, so that didn't help. I mean, it was good though, because the nurses came in. They kindly took him out of the room for me so that he could sit with them. And then I was able to turn off all the lights and then let my medication take effect.
Oh, good. I'm glad to hear that. Now, how would you describe this migraine to me if you were to describe it?
Well, it's a severe pounding is the best way I can describe it.
And can you tell me where the severe pounding is?
Yeah, it felt like the whole front of my head.
Wow. And out of 10, 10 being the worst pain that you've ever experienced, how would you explain this migraine?
I probably would have rated it about a 7 to 10.
And when do you normally get these migraines, and how long do they normally last?
Normally I get them at night. They can last for hours. I know this one did.
Wow. What do you think causes them, Mark?
You know what? I'm not sure, but I think it's when I'm stressed out. I seem to get them more when I've been overstimulated. And being in the hospital is not easy.
No, I can absolutely appreciate that it's been difficult, especially during this time.
Yeah, for sure.
As it is part of our head to toe assessment, I'd like to do a quick neurological exam on you, if that's okay. Now, we've already spoken about your migraines, so thank you for sharing that information.
Of course.
Now, this may sound silly, but can you tell me where you are?
Yeah, no, I'm in Northumberland Hills Hospital. To save you the trouble, it's April 19th, 2020. And my birthday is March 10th, 1962, and I'm 58.
All right, I'm just going to confirm that with your bracelet. And sorry, what were you going to say?
I was just saying that we're having a pandemic at this point.
We are in a pandemic, aren't we?
Yes.
So your face I can see is symmetrical. Can you give me a smile? That's wonderful. Your smile is symmetrical. Now I'm going to check your pupils now. I'm just going to look at them. They're both round and they're equal. Now I'm going to get you to look at the clock on the wall over there if you could. So I'm just going to get out my light. So I did know that your pupils are equal in size and they're round, but I want to know whether or not they react when I shine a light on them, okay?
Mm-hmm.
Oh, sorry. There, okay. Wonderful. Those pupils are equal and reactive when they constrict to the light, which is great. So can you please watch my pen or my pen light for me? I want to note that your eyes converge equally, and they do. So, and I'm happy to see that you're in good spirits as well. So I'm going to be looking at your upper extremities now, and I'm going to remove your gown, okay?
Yep.
So I'm noting that your upper extremities, they do look symmetrical, so you have equal muscle mass. There is no cyanosis and no pallor that I can note. Your skin is intact. There are no wounds. If there were wounds, I would assess them and redress them. There's no edema. Now I'm looking at your brachial pulses and your radial pulses, okay?
Mm-hmm.
Now your brachial pulses are equal and strong. And then I'm going to do your radial pulses. And those are equal and strong as well. Can you do me a favor? Can you squeeze my fingers? Well, that's good. You're showing me that you have equal muscle mass on both sides. Also, I'm just going to feel your skin. Now, what I'm just looking for, I just want to know if your skin is dry and to make sure that you're not having any, that it's warm and dry. Now, I'm going to squeeze your fingertips. That's okay. Now, what I'm looking for is to ensure that they blanch and then the color returns within 3 seconds. And they do, so that means that you have normal cap refill. I'm also noting that you don't have any, I'm going to palpate if that's okay. Now, what I'm going to ask of you is if there's any tenderness.
Yeah, no, nothing.
Okay. I'm looking for lumps and bumps. Nothing?
No.
Okay. There, all right. Now your ribs, they're sloping downward.
Mm-hmm.
And you have an elliptical shaped thorax. And I do want to note that your costal angle is less than 90 degrees right here. Now again, you don't seem to have any increased work of breathing, meaning you have no accessory muscle use. I'd be looking for some trachea in drawing here. And also I know that your trachea is midline and it doesn't deviate to the left or the right. Now I'm going to continue on with this assessment. Now when I palpated your chest, did you have any discomfort?
No, nothing.
Okay. Now with your permission, I'm just going to use my stethoscope and take a listen to your chest.
Yeah.
Okay, lovely. Now if you could do me a favor and just take a deep breath every time I move my stethoscope, okay?
Yeah.
You're doing great. And one more. So what I'm doing is I'm listening for any adventitious sounds. So when you came in initially with some fluid overload, we could hear some crackling in your lungs, but I don't hear any of that now, and I don't hear any wheezing at all.
Good.
So that crackling did indicate that you're having a bit of fluid overload.
Mm-hmm.
Also, I am hearing that you have good air entry from the apex to the base, so that's good. And I'm going to take a listen if that's okay to your heart sounds.
Yep.
Okay. 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 The first area I'm listening to is the aortic valve. It's in the center intercostal space right to the sternal border. And at this point, S2 is greater than S1. And the second sound I'm going to listen to is over the pulmonic valve. It's in also the second intercostal space, but this is to the left of the sternal border. And here I hear S2, S2 is greater than S1 again. The third spot I'm going to listen to is Erb's point. It's at the third intercostal space, just slightly to the left of the sternal line. And here S1 is equal to S2. And the fourth spot is going to be the tricuspid valve area, in between the fourth and the fifth intercostal space, to the left of the sternal border. And here S1 is greater than S2, so here it switches. And the fifth spot will be in line with the midclavicular line in the fifth intercostal space. And this is the point of maximum impulse. And this is where I would listen for a full minute if I wanted a full indication of your heart rate. And that's especially important if you're administering medications such as